Hello everyone, good evening. This is Dr. Nileshraj, faculty for pharmacology. Welcome to one more Why Conundrum. I hope you guys have seen the previous sessions already. I'll just give a small intro if you have seen this video for the first time. In this Why Conundrum, we'll be taking up the question why. We'll be taking up an important one-liner, which is very much important clinically, and we'll be going back in time. Why is that, and why is that, and why is that? A beautiful concept of Why Conundrum. Previously, we finished one session of Y conundrum, and now we'll be talking about a famous interaction between warfarin and amiodarone. First of all, what is warfarin? Warfarin is an anticoagulant agent, and amiodarone is an antiarrhythmic agent. Frequently, both of these drugs are given together, especially in terms of atrial fibrillation or in lots of different conditions. We used to give both of these drugs together. You have to understand in depth regarding the interaction between warfarin and amiodarone. First of all, please understand that warfarin. First of all, please understand that warfarin drug dose must be reduced when given with amiodarone. When given with amiodarone, this is the famous one-liner. Whenever you give warfarin and amiodarone together, the dose of warfarin must be reduced by up to 30 to 50%. Previously, if you are administering a dose of warfarin, when you decide to add amiodarone for the patient, the dose of warfarin must be reduced by 30 to 50%. So we'll be talking about the famous question. Why is that? Why this dose must be reduced? It's because, is it an interaction? Is it like more toxicity of warfarin or more toxicity of amiodarone? Please note down that amiodarone increases warfarin toxicity. Amiodarone will increase the chances of warfarin toxicity, so the patients will start to bleed. Again, we'll come up with the famous question. Why is that? Why amiodarone is going to be increasing the chances of warfarin toxicity? There are two major reasons because of it. Why amiodarone increases warfarin toxicity? Two major reasons. The first reason is amiodarone is a powerful microsomal enzyme inhibitor. Microsomal enzymes are those enzymes which are present inside your liver, responsible for the breakdown of major or majority of the drugs which we administer. One famous drug is warfarin. Amiodarone is a microsomal enzyme inhibitor. So if the microsomal enzymes are getting inhibited, warfarin will not get metabolized. So warfarin will tend to accumulate. The first important reason. Amiodarone will inhibit two important enzymes, CYP2C9 and it inhibits CYP3A4. Two important enzymes will be inhibited by amiodarone. Out of this, the CYP2C9 is primarily involved in the breakdown of warfarin. So what happens? There will be inhibition of warfarin metabolism. Warfarin metabolism is going to get inhibited. When warfarin metabolism is getting inhibited, warfarin will tend to accumulate, causing warfarin toxicity. Again, we'll dig deeper. Why? Why amiodarone is serving as a microsomal enzyme inhibitor? So I hope you understand where we are going. That's the concept of why conundrum. We started with the first statement. The dose of warfarin must be reduced when given with amiodarone. Why? Because amiodarone will increase warfarin toxicity. Why? Because amiodarone will inhibit microsomal enzymes, thereby increases warfarin toxicity. Why? Because amiodarone is a highly lipophilic agent. Amiodarone is a highly lipophilic agent. Lipophilic, not phobic, it is philic agent. If it is highly lipophilic, just guess, it can easily cross a lot of barriers. Yes. So because it is easily crossing a lot of barriers, it will be accumulated more in the liver. It will be accumulated more in the liver. So when amiodarone is getting accumulated more in the liver, there is more chances of it to form a bond, to form an quasi-irreversible bond with the heme ion. It forms a quasi-irreversible inhibition or irreversible bond with the heme ion present in the microsomal enzymes. That is how amiodarone will serve as a microsomal enzyme inhibitor. So what about the metabolized product of amiodarone? Amiodarone also might get metabolized. Here is the take-home point, buddy. An interesting point to note down is amiodarone is there. Amidarone's breakdown product is there, which is dis-ethyl amiodarone. disethylamiodarone. Both of these drugs are highly lipophilic. The parent drug amiodarone and the metabolite disethylamiodarone, both of these drugs are highly lipophilic. Both tend to get accumulated more in the liver. Thereby, it might be producing a quasi-irreversible heme ion bond, which leads on to a microsomal enzyme, a powerful microsomal enzyme inhibitory property. That is also one of the reasons why we say amiodarone has got a very long half-life. Whenever you administer, after amiodarone attains the steady state plasma concentration, even if you stop giving amiodarone, the effects of amiodarone will still be seen for across a month. Well, that is the beauty of amiodarone, guys. One of the longest acting drug. After it attains steady state, the level of the action of the drug will still be there for more than a month. That's the reason why there is more chances of toxicity symptoms. That's also one of the reasons why drug interactions are very much important for amiodarone. Okay. So this is the why conundrum. We have finished about one arm of the why conundrum. We have one more reason why sorry, why amiodarone tend to increase the warfarin toxicity. It's because amiodarone, see, note it down, it contains amiodarone, IOD, which contains iodine. There might be a chances of hypothyroidism, or in some cases there might be a hyperthyroidism. I hope you are knowledgeable about the Wolff-Chaikoff effect and Jod-based effect. So there might be production of either more thyroxine, or there might be production of lesser thyroxine. Even though hypothyroidism is more common when you administer amiodarone, there might be a possibility of amiodarone to produce thyrotoxicosis. Amiodarone might also produce thyrotoxicosis. That might be increased thyroxine secretion inside the body. So what? Here we're not going to be talking about why. Here we're talking about so what, because that's how we are going to be linking up with the interaction there. Amidor might be increasing the thyroxine concentration. Now what happens is, whenever there is increased thyroxine levels, whenever there is thyrotoxicosis, there might be increased metabolism. Of course, we know BMR is going to get raised, basal metabolic rate is going to get raised whenever there is increased thyroxine. The thyrotoxicosis induced by amiodarone increases the metabolism of vitamin K dependent clotting factors. What are all the vitamin K dependent clotting factors? Factors 2, 7, 9, and 10. These molecules are going to be quickly getting metabolized and thrown out from the body. Now, going back to the same old concept. What is the mechanism of warfarin? Warfarin is a drug which tends to inhibit these vitamin K dependent clotting factors. When warfarin inhibits the vitamin K dependent clotting factors, warfarin behaves as an anticoagulant agent. Is that clear? Now, this amiodarone, whenever it is administered for a longer duration of time, it might induce thyrotoxicosis, increase thyroxines, quick breakdown of vitamin K dependent clotting factors. And in the same patient, when you add warfarin, what happens, guys? That's the half of the job of warfarin is already been done by amiodarone-induced thyrotoxicosis, which itself might induce warfarin toxicity, which itself might induce warfarin toxicity. So two major reasons why amiodarone, whenever it is administered along with warfarin, the dose of warfarin must be reduced. Two reasons, guys. What's number one? Microsomal enzyme inhibitory property of amiodarone. And what's number two? The thyrotoxicosis induced by amiodarone. And we have linked it up with how beautiful warfarin is going to be producing the toxicity symptoms. So what happens at last? Because of both of these reasons, whenever amiodarone is administered and warfarin is administered without any dose changes, patients might land up in bleeding. There might be a sudden episode of bleeding. It might be hematemesis, or like a blood vomit, or hemoptysis, or hematochezia, or melena, or purpura, or any type of, or extradural or subdural hemorrhage, any type of hemorrhage. It might land up in bleeding. So that's the reason why we have to make sure that the dose of warfarin is going to be decreased up to 30 to 50% whenever you're going to be adding up amiodarone. I hope I have done justice to this beautiful topic, guys. I hope you've understood the reason behind. I hope you understood what exactly, how why conundrum actually works upon. We'll meet up in one more why conundrum as early as possible. Bye-bye. Good night.